Hi, everyone. We're just going to give it a few more minutes to let other people join. Thank you. Hi, everyone. We're just going to give a few more minutes to let other people join. Hi, everyone. We're going to start in just 2 more minutes to let other people join the webinar. Thank you. Okay, so I think we're going to get started. Dr. David West is going to be joining us in a few minutes, so I'm just going to go over some housekeeping things before that. Welcome to Cook to Reduce Risk, Spotlight Women's Health and Gynecological Cancers. This program is brought to you by Northern Westchester Hospital's Cancer Treatment and Wellness Center in the Center of Healthy Living. I'm your moderator for today. My name is Jackie Horn, the Cancer Center's registered dietitian at Northern Westchester Hospital. With me today is Dr. Gazelka David West, our gynecological oncologist, which I just said she'll be joining us in just a few minutes. This afternoon, we will discuss the connection between nutrition and gynecological oncology. We will learn to make Mediterranean white bean soup and a fall harvest farro salad. This recipe will be great for you and your family to enjoy. We invite you to cook along with us. This information is important for all women and anyone who has women in their life that they love and care about. Just some housekeeping that we want to go over. As time permits, we will take some questions and answers during the live presentation, but we're going to try to answer most of them at the end. So please put all of your questions in the question and answer function. The chat, I believe, is disabled because it's a webinar. Today, you will learn the facts about the latest gynecological cancer screenings and prevention recommendations, including facts about diagnosis and advanced treatment options and the role of nutrition in prevention. Take action to protect yourself and those you love. With proper screening, gynecological cancer can be detected early and is often beatable. Schedule your cancer screening today. For information on how to schedule an appointment with one of our doctors, call 877-469-4362, or you can go to our website, which is nwh.northwell.edu/contact us. We will be cooking today, so we invite you to cook along with us. The recipe was emailed to you ahead of time, or simply watch and make the recipe later. This program will be recorded and the Zoom link will be available to you later, or it can also be emailed to you after that. Lastly, throughout the presentation, to allow for more interaction with the audience, I will be launching some Zoom polls with trivia questions. You will see a pop-up box on your screen with a question. Please give it your best shot and we'll all go through it together. Okay. So first question. So which gynecological cancer is the most common? Whoops, hold on. I don't know if anyone had time to do it because it went so quickly. Okay. Just give it one more minute. Okay, so here's the results of what you guys put in. The answer is actually uterine. Uterine cancer is the most common gynecological cancer. Ovarian causes the most deaths. Cervical is most preventable, and the only gynecologic cancer with screening tests and a vaccine. So we will go through this together. Dr. David West has not come back yet. So I will go into what we're going to talk about today. So today we're going to go over what are the different types of cancers and their risk, screening and recommendations and risk factors, some symptoms you should be looking for, and then nutrition recommendations with cooking demos as well. So this is for Dr. David West. As I just went over in the questions, in the question for all of you, it was the different types and what was the most common. Here's the different types, and I believe that Dr. David West is going to go into more of the anatomy because most patients don't know all the different areas cancer can be hiding in there. And I guess most people don't want to talk about it. So there can be cervical, ovarian, uterine, vaginal, and the vulvar. And she wanted to talk about the picture. She should be coming in a few minutes. I don't know if she's back yet. Give me a second. I'm going to keep moving, and when she comes back, we can discuss this a little bit further. I know she has a patient today, so that's what was the holdup. So I'm going to discuss some of the risk factors.
Hi, Jackie, I'm here.
Oh, good. Okay.
I just can't start my video. It's not letting me.
Okay. Give me 1 second. Let's see if I can help. All right. Why don't you start talking while I work on the video?
Okay. So hi, everybody. Thank you so much for joining us in this webinar. Thank you, Jackie, for the introduction and for stalling a little bit while I got myself back on here. So this is a great discussion, great program that Jackie has put together for everybody, and the cooking also is really nice added bonus. I think, as Jackie said, we wanted to talk about the different types of gynecologic cancer, just briefly going through them. Most common is uterine cancer. That is the most common of all of these 5 gynecologic cancers. Just a bit of statistics. Every year about 100,000 women will be diagnosed with one of these. The most common, like I said, is the uterine cancer. The 2 most deadliest are uterine and ovarian. Well, for many years, ovarian was really considered the most deadliest, but now uterine is becoming really kind of neck and neck with that. We're seeing anywhere from 15 to 16,000 deaths annually from each of these cancers. So lots of work for us to do in early detection and prevention. The other cancers that we're seeing here listed are cervix cancer. That would be then the other more common cancer, followed by vulvar and vaginal cancer. And so anatomically, when we're talking about these structures, we have that image here. So of course, the fallopian tubes and the ovaries, in the higher part of the image, the pear-shaped structure is the uterus, with the gray of that is the muscle layer of the uterus, and the white is the endometrial lining of the uterus. And so the most common uterine cancers we see are going to come from that endometrial lining, that white part. Then down on that pear, the bottom part of that pear is the cervix. And that's what is tested with a pap smear. So the pap smear really just tests that bottom part of the entire uterus. So when you're going for your pap smears, it's not testing you for anything else other than screening for cervix cancer. And then the lower part of the picture, the vagina, and then the vulva is the external part where you have the hair, the labia, the clitoris, that's the vulva. And so cancers can affect that area as well, and the vagina. Those are much more rare, but we do see them occasionally in practice. But I think that's kind of the basic anatomy that I wanted to share there.
Okay, so I have a question for all of you before we move forward. So
there I am.
Are you on there?
I am. Hi.
So, all right. So next question for all of the participants. Is true or false, all women are at risk of developing a gynecological cancer? I'll give everyone a few minutes. Okay, so let me pull up the next slide. So the answer is that every female is at risk. Each different type of gynecologic cancer has different risk factors, and risk increase with age. So you can do certain things to help reduce the risk, and that's what we're going to talk about today. Maybe also paying attention to your body as to know what's normal for you and what's not normal. We're going to discuss this a little bit further, but some of the risk factors include, different health conditions such as diabetes or hypertension, HIV infection or AIDS, hormone replacement therapy after menopause, HPV vaccine infection, obesity or excessive weight, smoking, and then also abnormal growth on the endometrium, age, genetic predisposition, infertility, or no history of pregnancy, menstrual issues, personal or family history, and then PCOS. Is there anything that you would want to touch on that, Dr. David West, before we move forward?
Yeah, so this list of risk factors, it's great. It's very comprehensive, and really, it's if we had more time and had another lecture or another webinar, we could delve into which of these is specific to each type of cancer, right? Because not all of these are for one. So I think what I can maybe just speak to is just emphasize. So uterine, like I said, is the most common cancer that we see. So when we're thinking about uterine cancer, of these risk factors that we see here, the ones that would lean more towards that are the obesity and excess weight, the hormone replacement therapy, diabetes, and if there's irregular menses, PCOS history, and then of course abnormal growths in the endometrium. So I say all that because, with uterine cancer, the most common that we see, the most common type is a hormone-driven, estrogen-driven type. Excess estrogen in the system overstimulates the uterine lining, and that is what then can create an environment for overgrowth of tissue. Cells are then in a constant replicative state, and that breeds for mutations, and then precancers can form, and then cancers develop. And so when you're overweight or obese, your fat cells have an enzyme in that converts any steroid in your body to estrogen. So that estrogen is now circulating in your system, too much of it. If you're menopausal, your body has stopped making the progesterone and estrogen naturally. So now you don't have progesterone, which counteracts estrogen. So now there's all this estrogen in the system with nothing to kind of block it or shut it down. And so that overstimulates the uterus and then can create this cancer. Diabetes plays a role because an insulin-resistant state also can contribute to inflammation, increased inflammation, then can predispose or harbor risk for cancer.
We do have one question in the chat that I think is pertinent to what you were just saying. Is someone wants to know, why does weight play such a big part in uterine cancer?
Yeah, and so I saw that question, and I think I essentially touched on it, and it's really because of that conversion of steroids in the system to estrogen. So now you have all this extra estrogen floating around, and then also the excess weight, obesity, creates a chronic inflammation state, and basic biology of cancer tells us that these cells thrive in that high inflammation, high stress state, and that's what obesity creates in the body. So a lot of cancers, not just uterine, are linked to obesity and being overweight.
So the next topic that we were going to talk about is the different screening options. So Dr. David West, can you go into detail about the screening for different types of cancers?
Correct. Yeah. So right now, when we look at all the cancers that we described, the 5 cancers, really the one that we have true screening for is cervix cancer. That is just like when you think about breast cancer, what is screening for breast cancer? It's mammograms annually, and MRIs will be thrown in there, or ultrasounds, depending on your risk factors, depending on their findings on the mammograms. But so really a screening test, it screens for a disease. It has to be a non-invasive test that then results in, that then leads to a diagnostic test that is also, again, not very invasive. So pap smear, you go in for your pap smear. If you're a gynecologist, they swab your cervix. It looks under a microscope and we see are there precancer cells there or not. HPV testing also is done, and that's to see if you have any high-risk HPV, because the high-risk HPV, which is human papillomavirus, is what is linked to cervix cancer. So that's the true screening there. If any of that comes up positive, biopsies, potential excisional procedure. So that's a classic screening test. It's very effective. It's resulted in decreased rates of cervix cancer. And of course, the HPV vaccine that we have for men and women aged 9 to 45 also has helped decrease the rates of cervix cancer. So screening and preventative approach there. The other cancers that we have, really, unfortunately, ovarian cancer, the other deadliest cancer, has no early detection. We don't have any good screening for this. And so the best we can do is get detailed history from patients, family history, personal history. Pelvic exams are important there. And pelvic ultrasounds are done really not routinely, but they're done if there's symptoms, if there's something felt on exam. And so that's done in conjunction with a good clinical history, good physical exam. And then, of course, in the high-risk patients who may have a strong family history of ovarian or breast cancer, or maybe a patient who has been tested and confirmed to harbor a genetic mutation such as BRCA1 or BRCA2, those patients are then put into a screening program if they're not ready to have risk-reducing surgeries. And that screening includes a pelvic ultrasound every 6 months, and the CA-125, which is a blood test that is used to detect ovarian cancer. It is not, again, something that is used universally because it's not specific enough or sensitive enough to test the entire population to say this one test will tell us if you have ovarian cancer, if you're at risk. Unfortunately, it's just not a good enough test for that. But in the high-risk population, a trend we've seen with data, a trend in surveillance ultrasounds and a trend in surveillance CA-125 can give a clue or a hint that could there be something, could we detect something early? It's not a perfect test. I think one of the studies that looked at it said for every 10 of the 10 surgeries that were done for an abnormal finding, only maybe 1 or 2 cancers were found. And so that's not a good enough screening test. We're putting too many people, putting them under an invasive surgery to not find enough early disease. So that's one of the concerns with ovarian cancer early detection. Uterine cancer screening, again, it's more, again, history and clinical history. If there's any report of abnormal bleeding in somebody who is premenopausal or perimenopausal or postmenopausal, any abnormal bleeding, a biopsy is done. So that's the screening that we do in that sense. If the history indicates it, we then do an endometrial biopsy to test that lining that I outlined in that picture. And that's what will then tell us, is there a precancer or cancer of the uterus? Also, ultrasound helps in that sense as well. We use the ultrasound to measure that lining greater than 4 millimeters in a postmenopausal state is then now considered potentially at risk for uterine cancer, and then would have further testing or biopsies of that lining.
So going off of that, because you kind of cleared even some of my questions about being diagnosed and staging options, but also I wanted to talk about symptoms. So I'm going to ask the group to see if they can tell me let's see if this goes, if all the cancers have the same symptoms. So I just want to see if that, you guys have a few minutes to true or false. And then Dr. David West, if you can talk a little bit about the slide that's next that has that little picture that we discussed earlier.
Yeah. Do you want to change the slide or is it?
Yes.
So yeah, so the symptoms, I think one of the misconceptions, I'll speak specifically to ovarian cancer, is that it's a silent killer, or it has no symptoms. And that became kind of the thought because so many patients, about 75% of women, will be diagnosed at an advanced stage. And it's really not because there's no symptoms, it's really just because of the lack of early detection. The symptoms for ovarian cancer are there, but they're vague and they could be anything. As this diagram shows, it's bloating, feeling full after eating, pelvic pain or abdominal pain, maybe trouble with urinating or difficulty urinating. We can have these symptoms on a daily, once every few days, or if we eat something that doesn't settle well with our system. So, it's hard to kind of pinpoint it, but I think what I want to express and stress to everybody is the persistence of these symptoms, that they last, they don't go away. They don't get better if you took your antacid that morning or that you stopped the milk that maybe you're lactose intolerant. They are persistent for now 2 or more weeks. Really, guidelines state, like 4 weeks of persistent symptoms, and then you need to be evaluated by a gynecologist along with your primary care doctor. I think a lot of times patients will go to their primary care, and if the primary care doctor is not, has a high alert for a gynecologic malignancy, they may not think of that and send you for further imaging or further testing. They may just say, oh, it's a UTI, let's just treat that, or oh, it's heartburn, let's just treat that. So this is why I say include your gynecologic provider, your general OBGYN in that assessment if you notice you have these persistent symptoms for 4 weeks or more. Other of the cancers we have, I mentioned uterine cancers, the abnormal bleeding. Cervix cancer is also abnormal bleeding. We see cervix cancer in the younger patient population typically. And so what will happen is it's a patient who has regular menses, but now all of a sudden they're bleeding between their periods, or they're bleeding after sex when they never did before. And so that's something that would then prompt an evaluation by your gynecologist to see if there's anything of concern there. Other symptoms of cervix cancer that are not kind of highlighted here, but also pelvic pain, back pain, sciatica kind of pain that's persistent, right? I think persistence of symptoms, and those are symptoms usually that are seen in more advanced disease, if cervix cancer is more advanced. And then the chart highlights the other cancers of vulvar cancers, which is more vulvar irritation, itching, burning, a lesion or lump. Vaginal cancers is typically bleeding abnormalities and pelvic pain.
So I know you have to jump to your patient and then you're going to come back. So I wanted to ask you.
Oh, no, I'm good.
Okay. So then the next slide you kind of already discussed was diagnosing and treating. One question I just wanted to follow up though was, what is the benefit of seeing you versus the OBGYN, for example? Because I think that's very confusing.
Sure. So GYN oncologists, who are we? So we're double board certified in OBGYN and subspecialty gynecologic oncology. So we're fellowship trained to diagnose and treat these gynecologic cancers, either with surgery or cancer-directed therapies like chemotherapy, immunotherapy, or other targeted therapies. When do you see me? It's really if your general OBGYN thinks you need to or refers you to me with an abnormal finding or confirmed cancer diagnosis. You don't typically come to the GYN oncologist for an annual checkup. That's not our role. Our role is if something abnormal is found. And quite frankly, you don't want to come to me unless there's something abnormal found. I think it causes a lot of stress and anxiety for patients when they're sent to me, maybe with an overabundance of caution. Let's say their gynecologist is just, a little concerned with something, just not sure. And they send to me just, to give a level of reassurance or confirm whatever findings are, benign and not cancerous, right? But I will say, if you don't need to see me, it's better. But of course, if there's any levels of concern or suspicion, you're happy to be seen. Patients with genetic predisposition, if they have a known mutation, typically will come to see me to discuss risk-reducing surgeries because those surgeries are best performed by GYN oncologists. And so they will come to me for counseling and planning and timing of their surgeries.
So let me ask this. If I see you, for example, because I'm high risk or something was going on, I see you today, do I still have to see my OBGYN next year or in a few months for like an annual, or do I only see you now?
No, so I would say you would continue to the relationship with your OBGYN. So a lot of times I serve as like a consultant, right? So similar to like your primary care doctor that sends you maybe to the gastroenterologist, then you don't just start seeing the gastroenterologist, you go back to your primary care. So your OBGYN would then continue to do your annual visits. And if there was something that came up with me, let's say there was a high risk cervix, high risk precancer cervix lesion, right? And then the general GYN sent you to me and I excised it and cleared it. We would then see each other for follow-up visits a couple times after that procedure. And then once we know everything is clear, I would then discharge you back to your primary GYN.
And there is a question in the chat, and they were asking if there's a specific type of gynecological cancer that is that you're seeing more in the recent years.
So really, uterine cancer is really up there. I would say probably 80% of my patients in the office that I see are going to be a new diagnosis of uterine cancer, or then somebody who's on their cancer journey with a recurrence or cancer-free several years out. But that's the bulk of the patients are uterine cancer.
Okay. All right. So now I'm going to go into how to reduce your risk. And we're going to talk about one of the questions also in the chat as well. So maintaining a healthy weight, I think Dr. David West kind of talked about if you're overweight, it does increase your risk of certain types of cancers. Staying physically active, that's good for obviously any disease or any cancer for that matter, but limit high calorie foods and sugary drinks. So you want to avoid the sugary drinks, which can increase the risk of endometrial cancer by 78%, which is pretty big. Eat plenty of fruits, vegetables, and whole grains, which we're going to talk about more today. Consume a moderate amount of red meat, which I talk about with all of my cancer patients, but we're going to dive into that a little bit more. Limit alcohol consumption. I typically suggest one alcoholic beverage. It does not matter which one it is. Everyone asks me that as well, per week. And limiting your salt. So we're going to talk about that a little bit with some of the recipe things that I came up with today. So the only question I had for Dr. David West, I don't know if she just needed to see her patient, that we had in the chat was about, is there a percentage of lifestyle changes that play into the cancers, would you say? Like what percentage of lifestyle choices play into the gynecological cancers? I don't know if you can. When she comes
Sorry,
back.
I got knocked off, but I'm here. My video doesn't work anymore.
Do you know off the top of your head if there's a percentage of lifestyle choices that play a role?
Sorry, was that one of the questions?
Yeah, I didn't know. So
yeah, I don't know. This is the kind of question I defer to our nutrition experts. But I think, more, you can't go wrong with more better lifestyle choices than less. I think, of course, everything, I think the cliche statement, everything in moderation, I kind of live by that and abide by that. And I think healthier choices are better than non-healthy choices.
And Dr. David West and I also reviewed this presentation before we went live. And the one thing that we were talking about is it's more about consistency. So if you find out there's someone in your family that has a history and all of a sudden you change your diet for a week before you go see your OBGYN, that 1 week is not going to make the biggest difference. It's more about consistency and making sure that you are living a healthy lifestyle on a normal basis. So I don't really know the percentage off the top of my head, if that's really what the participant was asking. So nutritional recommendations to reduce the risk of gynecological cancers would be the fruits and vegetables, having an abundance of them, which we're going to dive into a little bit deeper. Whole grains, I'm sure you've heard this before, but having half of your grains be whole grains is what the recommendation is now. Being plant forward or plant-based. So we're going to discuss what the difference is, and limiting red meat. I think for most of my patients, that tends to be very hard because they're not just making a meal for themselves, they're making it for their family. And not everyone in the household is going to want to eat maybe tofu or even, just beans, like a soup that has beans. They want to have their hamburger or pork, for example. And then limiting alcohol, which we're going to dive into a little bit more as well. Okay. So ways that we can eat more fruits and vegetables. So we want to make veggies like the main event, which I find to be very hard for a lot of people. I always give this example, but if you're going to a restaurant and you're getting a hamburger, the only vegetable on the plate is going to be the lettuce or maybe the tomato that's on the hamburger, because there's French fries and maybe you have a Diet Coke or a milkshake, whatever it might be. So I tell people then to plan for that. If you're going to have the burger, then maybe don't have the fries, have some vegetables, have a big salad with it, have maybe a bigger salad for lunch. If you know you're going to have the hamburger and fries for dinner, play around with it. You can purchase frozen fruits or vegetables. A lot of people always ask me that they think the fresh is always the best. Also, it might be the cheaper option, fresh, depending on frozen, if the prices keep going up as the way they are right now. But buying them frozen is perfectly fine. Usually they don't have added things on the fruits and vegetables. I'm speaking more to the vegetables. If you were to buy the broccoli with cheddar and cheese on it, then obviously there's going to be loaded salt on there. If you wanted to put cheese on your broccoli, by all means, do it yourself. Don't buy it frozen because there's other things to preserve that. But frozen options are great, and it's easy because then you can take it out as needed. You can add veggies to eggs or chop meat and grains. So that's always good if you wanted to just bulk up whatever you're making and maybe your family doesn't think that you're having as many vegetables. I tend to do that with my family, and that's the way my mom always did it with my dad. So that's always a good option. Enjoy stews and soups. So 'tis the season now, it's getting much colder. Soups are a great way to throw in whatever you have in the fridge or whatever's in season, or maybe if you still have a garden running. I know like my dad gave me kale and that's what we're going to be cooking with today. So that's something that you can hide in those vegetables and then you don't realize how much you're actually getting, which is good. And then adding vegetables into smoothies. I always put spinach, for example, into smoothies, and I tell my son it's just becomes green, like a green Hulk smoothie, to make us big and strong, but it doesn't change the flavor. And I think that's what's so great. It does change the color. Kale is another one that people tend to do. It just becomes a little bit grittier. So you have to make sure you're really blending it well. Making snack time fun with vegetables. So if you know that you have people coming over, say it's Sunday football and you have lots of unhealthy appetizers, maybe make a nice vegetable platter and you make it fun with festive things like, I don't know, a pumpkin that looks like it's spitting out the dip with all the different vegetables. You can eat the rainbow and have all different colors as well. The other thing is substitute fruit purees with baking. So I tend to do that with my younger kids, but I know a lot of people don't do that on a normal basis, but it is nice to change out if you want to make muffins and put bananas in there or use applesauce. So then you're not having a lot of, fatty things or even sugary things in these baked goods. Okay. So choosing whole grains. Types of whole grains. Let's start out with brown rice, oats, quinoa, farro, barley, whole wheat bread. Those are just some of the few options. Me and Amy were talking about how we always kind of go over almost the same thing every single time we have these presentations. And I find that the whole grains, a lot of people do not want to experiment. And I'll be honest, I'm probably one of them. My family is not a quinoa person. I decided not to do quinoa, for example, in this presentation, because I think a lot of people know what it is, you like it or you don't. I decided to do farro because I don't think everyone always cooks with that. But there's another thing to also think about is like how you can start adding them into your diet. So mix in white rice with whole grains. So if you want to do white rice with a little bit of quinoa, I've seen that actually in the grocery store already pre-done. You just have to take it out of the bag and then put some water with it. You can make a whole grain risotto or even fried rice. I know Amy's done a few presentations in the past with fried rice to change it up a little bit. So you can see how to make that. Adding grains to soups or stews. So that's always a great option as well. I always tell people pasta, if you want to have the real thing, which is not whole grain pasta, that's okay. But then make sure that you're having maybe brown rice with your sushi the next day, or have quinoa in your salad for lunch if you know you're going to have something that is not whole grain later in the day. Mix white and whole grain flours into baked goods. I find that it really doesn't change too much of the flavor, and most people wouldn't know. So if you have whole wheat flour, you can do half and half, or you can just completely change it over and see how that goes. And then snacking on air popped popcorn, that tends to be very popular by a lot of my patients. Just making sure that you're air popping it, you're not buying the movie theater popcorn, and there's a lot of other butter and salt added to it. But that would be a good option to have late night if you're watching a movie with your family. Okay, so we're gonna start going into our recipe now. So Dr. David West, I'm actually going to hide your video so that people can see me better. All right,
Okay,
so
I don't think my video ever worked.
Okay.
Ever resumed, but that's okay. No worries, that's fine.
Okay, so we're gonna start with the fall farro salad. And this is just the ingredients. It doesn't have the directions. I know there was a question in the chat about the recipes, and I can send it to you in the chat at the end. And I know you'll get an email after you signed up for the webinar with the handout. So first things first is you want a medium butternut squash. You're supposed to dice it up. I just wanted to show you what I got at the grocery store today, actually. It was already prepackaged for me. I don't really have time to be cutting up a fresh one, and there wasn't much at the grocery store. So they do have this also frozen. So that is another option, but you might want to change how you're going to be cooking it. So I preheated the oven to 400 degrees. So there's nothing on it. It's just butternut squash. Let me see if I can move my screen a little bit. Okay. So I lined my pan with some tin foil. Okay. And then it asks for a little bit of olive oil. So I'm just going to do a little bit. Okay. Moving it around so that it's all covered. The next thing was adding cinnamon. And a little bit salt to taste. So I'm just gonna with my hand. Just want to make sure that all of the different pieces got the different ingredients. And then I'll just put a little bit of pepper on there. Okay. So now I'm gonna put this in the oven for, I believe it was 25 minutes, 25 to 30 minutes. There's really not much to this piece of it. So this is going to go in. Okay. Now move this up a little bit again. Okay. So that piece is done. And then the next part was to make the farro. So I did make the farro prior to starting the webinar, but I wanted to speak a little bit about that. If you haven't made farro before, the recipe actually said to just follow whatever the farro bag said or box. So it's very similar to making rice. This is what it looks like. I would describe the farro to be a little bit nuttier than rice. Nuttier in the sense of like the texture, not so much the taste. So if you've never made it, it's something that you can experiment with. I've had it as sides with different proteins and vegetables, but this is going to become part of the salad. One thing I didn't talk about with the butternut squash is that I'm sure with this recipe, you could have switched out if you wanted to use sweet potatoes because maybe you have it on hand or just 'tis the season. But the one thing about butternut squash that's great is it's rich in beta carotene and other carotenoids as part of eating habits that can reduce cancer risk. So that's something to think about. We use that olive oil, which is in a lot of the two recipes that I'm using today. But I did find a study that came out this year that's stating high consumption of olive oil can reduce the risk of cancer by 31%. And this goes back to, it's an anti-inflammatory. It's very similar to the Mediterranean diet. And this is one thing I talk about with all of my patients who are worried about reoccurrence, or even if they're just high risk. So think Mediterranean diet, anything anti-inflammatory. Olive oil is great for you. As Dr. David West said, everything in moderation, though. You're not going to be drinking olive oil, but if you would like to cook with that versus having something like canola oil, or even if you did a lot of coconut oil, I would be switching it out here and there. Okay. So we have the farro all made. like I said. So this can be used in like a risotto. You can put it in a salad. You could have it as a side. It's pretty versatile, I would say. So let's see if I can get a bowl for you. All right. So. So I'm just going to put this in a bowl. So this was 1.5 cups dry farro. Put the whole thing in a bowl. A lot of farro. Okay. So next it's saying to assemble all the other ingredients while we're waiting for the butternut squash to be cooking. So we have kale. I wanted to show you, there wasn't much kale options actually at the store this morning. So I did find it just in a container like this. The 4 cups was just about the whole container. So just something to think about. So here is our kale. Everything's getting wet over here. Hold on. Okay. Throw that in here. Hopefully my bowl is going to be big enough. So kale contains 4 times more vitamin C and twice the selenium content than spinach. I'll be honest, I have kale maybe 4 times a year. I have spinach almost every day. So it really depends on how you like to make it. At the hospital, sometimes they used to have kale salads and it was delicious, but I could not eat that all the time, especially because it's so raw. If you're cooking it, you can bake it and make it into kale chips, which I've done, which is delicious. You can also be putting it into smoothies, but it makes it a little bit grittier. So you have to make sure you're blending it really well. So the next thing would be the pomegranate seeds. So it's a good thing you didn't see me try to open the pomegranate because the whole kitchen got really red. So I opened a fresh pomegranate and tried to get the seeds out. As you can see, there's a lot of like meat from the pomegranate and the juice. So I'm going to use my hands to try to just get the actual seeds. And then I'll have to wash it because it's going to be like World War III in here. Pomegranate seeds are high in fiber and antioxidants. They're great for heart health and urinary health. So that's something to think about. Okay. So next we have crumbled goat cheese. If you were going through treatment, for example, I would say goat cheese would not be ideal if you're going through chemo. But if you were to cook goat cheese, that would be fine. So I'm just going to put the whole log in here and we can move it around. Next would be pepitas. So this is actually, I portioned it out for you, pumpkin seeds. So perfect season for it. They were all over the grocery store. I personally don't usually cook a lot with them, but if they're in a recipe that, or if they're in an option that I'm getting at the grocery store, or if it's already in a menu at the restaurants, I do like it. I just don't normally cook with it. So you just have to throw it in here. I'm going to use my spoon to move it all around. So the pumpkin seeds are great for prostate health, heart healthy, and for any cancer really. So far, this is what it's looking like. The goat cheese hasn't really moved around yet. And then I have our butternut squash. This is what it would look like once it's done roasting. I'm just going to throw that into our salad. And then we just have to make the dressing and we're going to toss it. Super colorful. I think it'd be great also if you were hosting a dinner and had people over. It's different and it's very seasonal as well. Okay. And then for the dressings, we have apple cider vinegar. So a lot of patients will ask me, oh, can I increase apple cider vinegar into my diet? I've read so many studies or articles about how it helps with cancer. Yes, you can have it in your diet. There's nothing wrong with that. A lot of people think that it makes the blood more alkaline, and that's why they want to increase it. Personally, I think that if you have it in a recipe, that's great. I don't think you need to be drinking it on a daily basis, like a shot, because some of my patients try to do that. But it's completely up to you, and however you're comfortable consuming it. The other components of the dressing, olive oil. So I'm just gonna dump the olive oil into the apple cider vinegar, and then honey mustard, which I'm sure you could have made your own honey mustard instead of buying it. And I'm gonna whisk this together. So this is all together. The one thing I know about kale is when you put different dressings in there, like different acidities, and it starts to break down, it's not as rough when you're eating it. So this will be nice once it sits for a little bit. I know there's a few questions in the chat, but I can address them as we get closer. Okay, a good replacement for kale, I would say spinach, and we're gonna have spinach in the next recipe. So you could even do like a different chard, like a Swiss chard or collard greens if you wanted to, but I think spinach would be the best. Goat cheese during treatment. If you're going through chemo specifically, they say you don't want to have a lot of the cheeses that could possibly grow bacteria, so soft cheeses. So I say goat cheese is one of those. Think back to when possibly you were pregnant at one time. They say not to have any of those cheeses unless they're pasteurized or if they're cooked. So if you have a goat cheese recipe and it's going in the oven, or brie, for example, that's fine. But if you're having it raw with other things, we just don't want it to start to go bad. You eat it and it might have grown some bacteria, and then you might get sick because you're going through treatment, you're not able to fight it off. That is a good question. Okay, so that's the first recipe. We're gonna let it sit, but this is what it looks like. And I need to move it around a little bit more, but it has lots of color, which is nice. Okay. I'm just gonna click that one. Whoops. Oh, I got honey mustard all over the computer. Okay, so next thing we're going to talk about is plant-based, which I know that was also just brought up in a question. Any cancer, really a lot of the different health conditions these days, they are saying to try to go plant-based. So what does that mean? It means 1/4 of your plate being plant-based, 1/4 could be whole grains with a healthy fat, half the plate being fruits or vegetables, making a healthy and delicious meal. Reframe your perspective. So meat can be a side dish, doesn't have to be eaten on a daily basis. I tell people all the time to try to have a meatless Monday. So then your family kind of gets used to that. I did that at home when I was growing up. My dad was not always thrilled, but, or you could, like I said, you can make a recipe that doesn't naturally have meats. People don't think, oh, I'm eating a vegan option tonight. It's like a different soup option. So we can talk about what I'm going to be making in a few minutes. The next thing is reimagine your favorite meals being plant-based. So maybe when you, instead of making real burgers, you might want to do veggie burgers and you can make it yourself. You can make a chili without the meat and have different beans in it, or you can even do like an Impossible burger instead. There's all different variations these days. You just have to be careful of there's any other added things in there that you might not want to be eating or high salt. And emphasize on nutrient-rich choices. So we want to make sure we're eating whole foods. And I think that's kind of what we're emphasizing on some of these recipes today. So we're not having a lot of processed things. If you needed to have, say, like the veggie nuggets or veggie burgers, that's fine, but maybe on a normal basis, if you're trying to go plant-based, to make sure that you're having beans in your diet or legumes or things of that nature. Okay. So next we're going to go into, I'm losing my image. Oh boy. The Mediterranean white bean soup. So let me get my pan. Okay. And before we actually go into this, I'm going to talk about one of the questions that was brought to our attention before we started our presentation. So people want to know what the link between diet and cervical cancer is. I'm going to see if I can pull it up for you before. It's just immune fighting food that's best for actual cervical cancer because of the HPV infection. So basically, not to confuse that if you eat all of these things, you're not going to get a gynecological cancer. What it really means is that if you have HPV infection right now, they do suggest to increase these foods: sweet potatoes, spinach, kale, other leafy greens, papaya, oranges, sweet peppers, tomatoes, broccoli, or cauliflower, because that can lessen the HPV virus in your system. It just has antioxidants, carotenoids, flavonoids, and folate, and that's what's helping with the HPV. If you can decrease the HPV in your system, it will lessen your risk for it to turn to cancer. So I think there's a lot of confusion of if you eat this, you won't have cancer, and that might happen, but it's really more of just lessening the risk. So let's just go back to.
Hey, Jackie, I'm gonna have to leave. So thank you for bringing up the link with the cervix cancer, and I'll just echo what you said. I think it's really the HPV that we're trying to suppress, maybe even clear from the system. There are some patients who anecdotally will say they ate X, Y, and Z, or they had a certain regimen of these antioxidant-rich foods, and their HPV cleared from their system. All their subsequent testing was negative, and that is definitely the goal. I think if a high-risk precancer is identified or a cancer, undergoing standard treatment regimens, excisional procedures, surgical interventions is, of course, the recommendation and the standard of care for our treatment guidelines and our cancer guidelines. But of course, incorporating these types of foods are a preventative measure and an immune support so that future precancers are less likely to evolve if the HPV is suppressed.
Thank you.
No problem.
If you need to head out, that's okay. And if there's any further questions that need to be addressed by you, I will reach out to you privately, and I can reach out to the participants after.
Perfect.
For hosting with me today.
Of course. Thank you so much, Jackie. And this is wonderful. I'm going to try your fall farro salad for sure. And the white bean soup. Looks delicious. Enjoy, everybody.
Bye. With the interest of time, I'm going to be slightly quicker with the soup, and you'll see how I'm making it, but that might not be a finished product. So we're going to do the olive oil. I'm going to start, just going to add olive oil. And like I said, all the benefits of olive oil. I'll also kind of touch on some of the questions that you had in the chat. Going back to the soft cheeses, basically what it means is it's called a neutropenic diet. We don't want anything that could grow bacteria like fresh fruits and vegetables if it's not really well washed. Or for example, if you've ever heard of like spinach having E. coli, there's different recalls. They don't want anyone who's going through active treatment to get sick because they can't fight off the bacteria that they might have consumed. Same thing goes with cheeses, but if it's cooked, then it's better. So again, think back to when you were pregnant and you might not have been able to consume those things because you might not have been able to fight off the bacteria from the different foods. Here's some chopped onion. We're just going to throw that in there. Okay. We're going to let that cook for just a minute. Next thing would be the garlic. Garlic is great for cooking really anything. It adds lots of flavor. I chopped it up myself. Nowadays, you can buy it already chopped. It's up to you. And some people don't like to have a lot of garlic. So this was 2 cloves. You just get a spoon. Okay, so it's starting to caramelize a little bit. Throw in the garlic. Okay, so after we do that, we're going to add the carrots and the celery. I'm going to move my screen so you can see me chop the carrots and the celery. Okay, here we go. So I peeled the carrots and I just wanted to show you how I was chopping them. Personally, I like everything to be a little bit bigger when I chop anything. Not everyone feels that way. So completely up to you. So carrots, very similar to butternut squash, sweet potatoes. It's rich in vitamin A, which is good for eye health, but it's also good as an antioxidant when it comes to cancer. And when you think of soups, you really think that there's always like carrots and celery. Think of like chicken noodle soup, things like that. All right, let's do the other carrot. One of the questions in the chat was regarding why we're limiting meat. So one thing that Dr. David West wasn't able to really talk about, but we talked about it privately, was a lot of women, when it comes to gynecological cancers, are worried about estrogen and what foods might affect the estrogen levels in their body for preventative reasons, and also if you've been diagnosed. So meat, there's been lots of studies showing that meat is actually one of the only foods that really does affect your estrogen levels. So red meat specifically. So if you're having chicken on a daily basis and then you decide to have a burger once a week, that's totally fine. But again, this goes back to consistency. And red meat also includes pork, which I know a lot of people do not think pork is red meat, but it is in the cancer world. But having, leaner meats, it's still not a bad option. Like I said, it's not always realistic to have plant-based for everyone. Okay, here's the celery. I washed it prior. Okay, just gonna throw this all in there. Okay, and then we're gonna throw in the vegetable broth. So it's 6 cups. It was about 1.5 cartons that I used. I did buy the low sodium. So something to think about when you're going to the store. Sometimes a brand might say low sodium, but it actually is more sodium than the regular brand. It's always good to be looking at the back before you're buying it. Same thing goes with beans. Beans typically don't vary in the sodium unless it says no salt added, which is almost rare. All right, so let me just make sure. Okay, so we're adding in our vegetable broth. We're gonna cook it for 15 minutes. So we don't have a full 15 minutes, but I'm gonna show you the beans, the spinach, the last pieces. So this recipe called for cannellini beans. It's 3 cans of cannellini beans. Personally, we have beans in our house all the time, so I'm very used to this, but not a lot of patients I find are used to having it in most recipes. Soups, I feel like they recognize it as pasta fagioli or chili, minestrone. That's normal for them, but making just a white bean soup is not something that they normally do. When you have anything canned, even if you buy lentils canned and you don't make it fresh, make sure you are rinsing and draining the beans. It reduces the sodium by 51%, which is really big when it comes to cancer. And even if you're feeling bloated, it's just overall health is really good to make sure that you're looking at the back of the nutrition labels, especially with different broths or different soups if you were to buy something. Okay, and then we have oregano and thyme, so I'm just going to throw this in. Okay. Someone asked about a substitute for kale. So here's my spinach. I probably could have switched it out if I wanted to do kale in the soup and spinach not in the salad instead, I mean. So this is rich in iron, vitamin K, potassium, vitamin A, and folate. In my last presentation, we had lots of questions about iron. If you don't have a lot of red meat in your diet, you can have things like spinach. You can also do beans. Beans are higher in iron as well. It might not be as high as saying having a steak, but if you are anemic and that's something that you're concerned about and you don't want to take a supplement for various reasons, you can increase the dark leafy greens. You can add more legumes or beans into your diet. So I am going to stir in the spinach. And here's the different oregano, thyme, and salt and pepper. Throw that in there. Let that cook a little bit, and we'll move on to the next slide because we only have a few more minutes. I want to make sure I answer a lot of your questions. Okay, so we talked about that. So fluids, I tell everyone drink lots of fluid. You want to limit the sugary beverages. Like I mentioned, it does increase your risk of endometrial cancer. If you like things that have taste, I've had a lot of patients say, oh my gosh, water is so tasteless. I can't drink all of it throughout the day. Then add something like lemon or lime or even like strawberries to infuse into the water. If you have to have a seltzer that's a little bit more flavored, that's fine. The one thing I say is that if you're not eating a lot because of treatment, bubbles will fill you up quickly. So try to make it a little bit more flat, and limiting alcohol to 1 alcoholic beverage a week. I believe there was a question about that specifically. Suggestion. I don't remember if there was a question about the alcohol, but basically having too much alcohol in your system, the way it's broken down into your body, it's more about consistency. I tell a lot of patients, if your daughter is getting married on Saturday and you know you're going to have more than 1 drink, that's totally fine. It's a celebration, but then make sure the next week you're not overdoing it, or the whole weekend you're not having 5 to 6 glasses of wine each night. You just want to make sure that you're drinking lots of water, staying hydrated, and not taking in anything like alcohol, which could really affect your risk of any type of cancer. Okay. And then just to recap, so the ways to prevent the gynecological cancers, all of them for the most part, would be maintaining a healthy weight, stay physically active, limit high calorie foods and sugary drinks, eat plenty of fruits, vegetables, and whole grains, consume moderate amounts of red meat, limit alcohol consumption, and limit your salt. If there's any other questions, I'll go through it in the chat. We did say it goes to 1. So if you don't have any questions and you would just like to wait to get the email for the recipes after this, thank you so much for joining us. I hope I answered a lot of questions that you had and you learned something from this. I hope you have a great day. Okay. So Sandy asked something about black tea and coffee. There are some studies that show that coffee actually is very good for gynecological cancers, which is interesting. So if you have 2 cups of coffee a day, it reduces your risk of gynecological cancers, specifically endometrial. So if you like coffee, that's great. If you don't like coffee, I don't think you need to start drinking it. It's just something to think about. But if you're going through treatment and you're not feeling well, don't overdo it. Different tea can interfere with treatments. I would just be careful about what you're consuming on a daily basis. I haven't read anything about black tea specifically with gynecological cancers and reducing the risk. So I hope that answered that. Follow-up sessions. If you have follow-up questions or you want to make an appointment with me or even with Dr. David West, you can get the survey at the end and you can give us your information and we can reach out to you. All right, I'm just going to answer 1 or 2 more questions. Okay. Suggestions for foods for metastasized breast and ovarian cancer. So there's not specific foods that I would suggest if you have metastatic cancer. What I would say is trying to stick to the Mediterranean diet. So that way it's anti-inflammatory. When it comes to hormones, because that's really what people are worried about when it comes to breast or ovarian or any of the gynecological cancers, red meat. I'm not as worried about the dairy as much as I am about red meat. So that's the biggest thing. So just keep that in mind. Maybe have turkey tacos instead of regular tacos, or use ground chicken in meatballs instead. So there's different ways that we can change it up. So that way you're not always having the red meat, and I can work with you on that. But I do find it's hard for a lot of families to get on board with that. All right. So let me just ask let me answer 1 more question. Okay. Copy of the recipe. So that's going to be sent to you in an email right after. From my understanding, it was supposed to be sent out, but I'm sorry about that. And while you guys are still on here, I'll just show you the soup. So the spinach is kind of cooking. There's beans and different veggies. Super easy, and it's great for the winter. It's kind of good for the whole family. So, all right, so I'm going to wrap up today. If anyone has any other questions, like I said, you have a survey that comes up as this closes out that you can ask us if you wanted to speak with us privately, or if there's any other questions, if there's anything that you need us to clarify. Have a great day. Thank you so much for joining.